Hi, I'm Dr. Joanne Smith.
And I'm Dr. Corinda Hankins.
And this is A Podful of Pediatrics. Subscribe here for more content.
Or go to onecommunityhealth.org.
Or follow us on social media at One Community Gorge.
This is
the one where we talk about
abdominal pain.
So abdominal pain has a long list of possible causes because the GI system, which is your gastrointestinal system, it's hard for me to say that, has more neurons than the brain.
Yeah, and we were talking earlier about the fact that it totally makes sense when we were doing the newborn talk that newborns have some tummy aches and colic and that kind of stuff. Because if you think about it, their gut is growing neurons just like their brain is. And if you have that many neurons to grow, of course it's not going to work right away.
No, and it's going to make your belly hurt a little bit and make you gassy. And, that's part of just becoming a person, right? So the most common causes of abdominal pain in kids are
constipation.
And constipation. Yes, there's other causes of chronic abdominal pain, but that is going to be the number one for sure.
So we are going to spend a lot of time talking about
constipation. Yes.
But we are going to talk about some of the other stuff that would make you worried, make us worried, and talk about things that we would work up and kind of might see in clinic and then try to help with.
So some other causes for chronic abdominal pain besides constipation are functional abdominal pain, which is kind of like nervous stomach.
Yeah, GERD or gastroesophageal reflux disease, which is basically a really fancy word for really bad heartburn.
Yes. And inflammatory bowel disease, which ulcerative colitis and Crohn's are the two kinds.
And then abdominal migraines, which is just like a migraine in the tummy.
Right, hurts. And then just other systemic illnesses like diabetes that can cause kind of chronic abdominal pain.
There are some red flags.
Big red flags
that we worry about that if they're associated with abdominal pain, lead us in much different directions that we'll talk a little bit about today, but not a ton. The first one is blood in the stool. So if you have bloody stool, bloody poops, usually there's something going on.
Right. And kids don't have black stool like adults with blood. It's bright red. If you see that, or if your kid tells you about that, we need to just evaluate them and figure out what's going on.
If you are not growing well, so if you have a lot of tummy pain and kids aren't growing, they aren't gaining weight, they aren't gaining height, those things worry us more.
Waking kids up at night, right?
Yeah.
Belly pain, typically that is of a chronic nature, usually doesn't wake them up at night.
Right. And pain that maybe isn't at the belly button. Most of the center tummy pain is pretty normal and often has a more benign cause.
Anytime your kid has problems walking.
Yeah.
Anytime they're limping, bending over, just walking like a pregnant person, any of those things, you're like, they should be seen. That is not normal.
Yeah. And then pain associated with vomiting and really the inability to keep fluids down, so they become dehydrated.
Kind of remember, though, that kids just say the truth. So a lot of times they'll say their belly hurts for things that we know what that means. They're hungry. They have to pee. They have to poop. They're excited, right? There's a lot of times I remember.
Or a little worried about something.
Yeah, I remember my daughter being like, my belly hurts because she was getting ready to go somewhere fun, right? And she was just saying, these are butterflies, but she didn't have the words yet to say butterflies.
Yeah, and I will say, I had I get a little worried about things sometimes.
What? No, never.
And with that, and I've had that my whole life. And so even before soccer games when I was young, I would have a tummy ache and often even vomited. Because I was so anxious or worried about those types of things.
You'd always be like, where does she go as we're warming up for the game? And be like, oh, she's over there puking. That's just part of, getting ready for the game.
And there wasn't really anything wrong with my tummy, right? I just was worried. And that's how it manifested in me. So.
Yes. And so anytime kids talk about belly pain, just kind of evaluate is this a situation where you might have a belly ache? Something else is happening, that's getting them excited or, they're nervous about.
And then always remember that tummy pain is often the most dramatic or the worst after they eat. And that's called the gastrocolic reflex. Basically, everything starts to work after we put food in it.
Right. Put something in your stomach, something wants to leave the bottom end. So it moves along.
So what kind of red flag abdominal pain do we worry about? When are we going to really seek emergent care, not necessarily work this up in our office?
So appendicitis is a classic one for kids, right? The right lower quadrant abdominal pain, but it usually starts around the belly button and moves to the right side. And these kids look sick. They don't want to eat. Sometimes they're vomiting, and we do something called the jump test.
Right.
Which,
and that also is like, if you jump, it hurts, right?
Right.
But even with walking, like they might walk crunched over. My daughter actually ended up with appendicitis, and initially it was just like a little kind of bad tummy ache as it started that morning. But by a little bit later in the middle of the morning, I'm like, oh, she's not walking upstairs normally.
yeah, she's kind of leaning forward, like she's about to
Bent
fall.
over. I was
Yes.
like, I think this is not the normal constipation or other issues. I think this is something worse. And so that was my cue to like kind of take her in. She also wasn't feeling very well, hadn't vomited, but didn't want to eat anything, and didn't act herself. She was having pain.
Yes.
Fever can be associated with it, but it doesn't always have to. She certainly didn't have any. But I was worried for all those other reasons, and she definitely had appendicitis.
Intussusception, we kind of talked about in a different podcast. That's where part of the bowel telescopes inside another part of the bowel, and it kind of comes really strong abdominal pains in big waves, and usually associated with vomiting and sometimes blood in the stool. And the kids will be screaming in pain and then okay. But it really is a different from kind of the chronic abdominal pain, because it kind of comes on really quick, and changes how they're acting.
Yeah, and often they get really sick and can't drink and can get dehydrated fairly quickly. And then we have like your bacterial stool infections, and there are like lots of different what we call gastroenteritis, where you have like viral vomiting, diarrhea, some tummy pain. That often, if we can just keep kids hydrated, they're going to do just fine. Bacterial stool infections often still cause vomiting, abdominal pain, diarrhea, really bad diarrhea, but often associated with worse tummy pain, worse diarrhea, and often even bloody stools with a lot of mucus. They are kids who really will have trouble keeping fluids down, get dehydrated more quickly, and we worry more about those kids because you can also get that bacteria that goes even into the bloodstream. Right. So those kids, again, we worry more about with bacterial stool infections. And usually those bacterial stool infections are often from something they ate or something they came into contact with that causes that.
Yeah, and so some other cute causes we didn't really talk about: pancreatitis, which is rare in kids but happens. Pneumonia will present as abdominal pain sometimes for kids because their bodies are so small. When there is infection in the lung, it kind of pushes on the diaphragm and makes their belly hurt too.
Right. Kidney stones, also uncommon with kids, but it can happen.
And then, more common now, kids are drinking soda more.
Yeah, like really soda bad for your kids. Don't
Yes.
let them drink soda. But anyway, and then the other ones that we talk about, older kids, are like pelvic inflammatory disease.
Or ovarian cysts.
Yeah, gallbladder, gallstones type thing, which again, not super common in kids, but it can happen and more likely to happen in adolescents. And then really one that's causing more and more trouble,
especially out here
in states that have legalized marijuana, is cannabis use.
And that just causes terrible abdominal pain and vomiting. And we have seen younger kids, preteens, have abdominal pain from cannabis use.
And teens themselves. And it is really hard because it is actually really, really significant and severe abdominal pain, and often causes vomiting. And again, the inability to stay hydrated.
Yeah. So those are like kind of the more acute ones, but they're not what we see most of the time, right? When kids come in for abdominal pain, and they do a lot, it's a very common complaint for visits and even just at well visits.
Right. Outside of gastroenteritis, which is kind of a common just viral infection that we see a lot, the most common thing we see that causes visits, and we'll talk about it even in well visits, is
constipation.
Constipation.
And it's amazing to me that kids can have a bowel movement every day and still be really constipated. And parents are like, but they go every day. Yes, they can go every day, but it doesn't mean that they're going all that they should, right? Like sometimes you just need to hang out a little longer.
And it's all about texture.
Yes, texture and size. And so there's a really good Bristol stool scale it's a good reference if you don't actually want to talk about poop with your kids, or they don't want to talk about poop with you. And it literally has pictures of the different kinds of poop.
I know. I included a little link to Choose Your Poo, which is my favorite one.
Yeah.
And I actually bring it up in clinic and let kids pick out what their poop looks like, and what it kind of texture it is, what consistency it is, and they kind of label them by food. So what the food they look
Which
most
is
like.
It's so gross, but you kind of get it, right?
Yeah.
Yes.
And kids don't mind talking about it.
No.
In fact, as soon as you like say, "Oh, what food does my poop look like?" They're like, "Oh yeah, it looks like that one."
Yes. So that's sometimes the conversation you have to have when your kids have belly pain and they're like, "Well, I'm pooping every day." What kind of poop are you having every day?
Yeah, if you have hard balls that you're getting at like a 1 or 2 at a time, that is constipation. It doesn't matter that you're pooping every day. It's hard, it hurts. Often it can even cause a little tearing or bleeding of the around the anal fissure, where you get these rectal fissures in there, and it can cause a little bleeding. Usually that blood is not gross blood like you see
It's
from
just like a little bit on the edge of the poop.
Yeah, it's a little on the outside. Yeah, or even when they wipe, right? And those are all like signs that they have true constipation. Large, big volume
Right, ones
stools.
that you have to use a plunger because they were too hard to flush. That is constipation. They held that in way too long, and it is now way too big. And it shouldn't. Every time anyone says, "Oh, my 3-year-old has a poop the same size as a grown man," oh, they're holding it in too long.
Yes,
for sure.
Yes. And, a lot of times saying that, we see it around times, constipation a lot around times of transition. So, for example, when we're teaching kids to potty train, like I call potty training, we are actually teaching them to withhold, right? To withhold to a time when they can go to the bathroom.
Convenient to go.
Instead of being able to just go whenever they need to. But with that comes a little risk. And if it hurts, they'll be like, "Ooh, I don't have to do that anymore."
Right. And kids are funny. They associate with pain with not wanting to do it anymore. So as soon as I had a pain a few more times, they're like, "Well, that's it. Never pooping again."
I'm just not going to do that
Which is
anymore.
not how the human body works, right? Like eventually you have to get it out of there.
Everybody poops and everybody needs to poop.
I love that book. That Everybody Poops book. It's a good one.
That's right.
And color of poop doesn't really matter that much as long as you don't see blood in it. We talked about kids don't really get black stool with blood. If they have a black stool, it is something they ate. Like an overripe banana is going to come out black in their poop.
Or if blueberries or like those things can kind of look black at times. Yeah.
Or if you have fluorescent poop, like glow in the dark poop, I'm always like, when did you go to a birthday party? Because that is icing from a cake until proven otherwise comes across as fluorescent poop.
Yeah. So colors, as long as they're not blood, we don't tend to worry quite so much about, especially with these things. But here's the thing to remember: kids will eat anything.
Yes, they will.
And most things come out in their poop without any trouble.
Yes.
And you don't have to worry about them. So, for example, coins outside of a quarter, like usually
they'll just go right on
through. They go through.
Yeah,
and
no
you
worries
can find
at
them
all.
on the other side.
Yeah.
But there are a few things that you need to be careful about eating.
Yes.
Actually, you had the weird one.
Yeah. Well, people have done like all kinds of jewelry. I remember in the ER, like people would be like, "Oh, they ate my diamond bracelet." How did they eat a diamond bracelet? Don't worry, it'll come on through. But the funniest was they found earbuds in their kids' poop. And they still worked. Like they came out, washed them off, and the earbuds still work.
Not sure people would want to put those in there, but
still, they're kind of expensive.
Right. But most things that we really do worry about, and really you should keep out of your house, are things like batteries or magnets.
Magnets are the worst.
Yeah,
they stick together inside the bowel, and then they can't move.
Right, and that you'll cause obstruction or even perforation of the bowel with those. So those little tiny beads that you like have fun stringing together, you should not have those around small kids.
Yeah,
they will eat them.
5
and it will
and
hurt
under,
them.
because even 5-year-olds put those in their mouth, and then someone talks to them, and then they just swallow it.
Yeah. And then cleaning and laundry products.
Yeah, like pods, are, like such a good invention, but so dangerous because they look like candy or some kind of cracker. So just don't have those around.
Keep those away from kids. But we are going to talk more about that constipation thing, because it is truly
a big part of our lives.
It is. Like I never realized when I graduated residency and I started my my pediatric practice, how much of my conversation would be about poop and specifically constipation. And constipation causes not just abdominal pain, because that's what we're talking about here, but it will cause other things too, like painful peeing, or accidents,
More
being
accidents at night.
Yeah, accidents at night. All of those can actually be caused by constipation. In fact, if you refer to a urologist about wetting, one of the first thing he's going to do is like check on constipation and treat constipation before he does anything else, because it's that common.
It is. So how do we treat it? I mean, the number one thing you do is you make time to poop, right?
Mm-hmm.
And that's why this holding it till it's convenient for a 3-year-old, there's never a convenient time to poop because they're just always busy doing something more fun than pooping.
Right.
So you kind of just try to get them to schedule, like we said, after you eat, it's easier to poop. Just have some time after they eat that they go sit. They need like a little stool or a little squatty potty so their hips and knees are equal, because they don't have the abdominal muscles to kind of push on to poop as much.
And this is one of the things you'll see, especially at that age too, that a lot of times they'll want their diaper on to go hide, and they'll actually squat like somewhere behind something to go poop. And I don't know why the behind thing is there.
Because they're kind of realizing it's kind of an embarrassing thing we don't do in public.
Right. But squatting is like characteristically, like it's easier for them to do. They use extra muscles to help them poop. And that is kind of their comfort zone. So if you have those squatty potties, that's helpful. The other thing I really talk about with respect to making it easier for children and trying to not have constipation.
Make them more willing to go.
Is you have to make them more willing to go. Potty or pooping, not potty, but pottying too. Poop should be fun.
A good time for all. No.
That's right. So going poop should be enjoyable and not painful, and
not a punishment.
Not a punishment.
Yes.
So you really need to reward this behavior. Like even just going and sitting on the potty at first, especially since it's a new experience, and especially if there was ever any pain associated with it, even going and sitting on the potty should have a reward of some kind. It does not have to be food. But
could be a little stamp on the hand, or they love
a sticker,
stickers,
or whatever you want. But it needs to have a time, like especially again after eating, but reward that behavior. And then if they poop, super party.
Yes,
like,
exactly.
Yay, poop party.
And a lot of kids love to read books at that age, 3 to 5. So that's the time to be like, this set of books just stays in the bathroom. You only get access to them when you're in the bathroom, right?
We still have those books in our bathroom.
I know, because
they're not looking so great
right
right now.
Poop being fun, right? You said that. Make poop fun. That's for sure.
That's right. The other things that we need to do is make sure they're drinking water.
Right. Water helps everything. It really does help everything. We talk about that for a lot of illnesses. It just gets better if you drink water. Mm-hmm. Constipation, 100%. If you drink more water, your poop will come out easier.
Yeah. So a lot of times that is especially in adolescence, I see a lot of constipation in adolescents, and it's, almost always they're not drinking enough water. Yeah. So hydration, and it still should be fun.
You don't have to flavor your water for fun. We can have a fun water bottle.
That's right. That's right.
And then talking about diet changes, I think the natural instinct is to be like, more fiber to help you poop. But if you're constipated and you do more fiber, you just made that poop bigger.
That's right.
And now it's harder for it to get out.
And it's actually, this is a common misconception where parents are like, oh, I've just been feeding them fiber, everything fiber. And it's just not getting better. And I'm like, well, basically you're making really big, hard poops bigger and harder for them to get out.
Right.
So fiber, not the important part when you're treating acute constipation.
Right.
We actually need to clean out that really big, hard poop. And then we use fiber to keep everything
to maintain,
to moving through and getting it out again, so that things have time to shrink back down to normal size. Because a lot of times the rectum is a muscle. I mean, not a lot of times. It is always a muscle, and it stretches with what's in there, right? Mm-hmm. And a lot of our sensation for pooping, our need to poop, is really at the bottom of our rectum. And so if everything really starts getting stretched out, mm-hmm. we actually, kids and adults for that matter, will lose that sensation. And that can cause real problem for children.
Yes. And we always say the rectal sphincter is the smartest muscle in your body because it can differentiate solid, liquid, or gas. You're mm-hmm. like, what needs to happen here? My muscle can tell me. But once it gets stretched out, it loses that amazing superpower. It
does. And that losing that superpower makes it really difficult for children. And so when you have severe constipation, that's happened for a really long time, things are stretched, all that sensation is not what it should be, is when we go from normal, or even pretty significant constipation to something called encopresis.
Right. And that is where the kids think they're just passing gas, or they don't even know if they're passing anything, but things are leaking out of their bottom.
Yeah. And that's where we really have overflow stool. And that is really important to recognize, that it is not their fault.
No, they did not choose it. Who would choose that?
Yeah, and they don't want it to happen. Often they're hiding like underwear and that type of thing because parents are like, why aren't you wiping well, or why aren't you doing this? Why are there all of a sudden poop in the underwear? And it's because they're just not sensing it.
Yes.
And you can't just tell them to stop. Like, this has been going on often for months,
maybe a year
prior to this.
Yeah.
And so just telling them to stop is not going to make a difference. And it's just going to make them feel bad. And it's also going to cause a lot of division between you and your child.
Right.
They feel guilty. You feel upset. It just isn't, it's a no-win situation. So again, pooping should be fun.
So no shame.
No
right?
shame.
Let's just talk about, let's get you back on a schedule. Let's you get more water.
And then really we need to treat the underlying reason that you're having this overflow stool, which
Right.
again, constipation.
So foods that help prevent constipation once you kind of get cleaned out: high fiber fruits and vegetables, high fiber breads and cereals, beans, all those things kind of like get things going once you kind of got the large bulk of stool out of there.
Yeah, green leafy vegetables, awesome for pooping. Things that not so good for if you want to keep poop moving through are lots of milk and cheese products, processed foods, like chips and other processed foods. And then the other thing, the other things that I always talk about is that there are some fruit that actually isn't so great for pooping. Bananas, huge culprit of little baby pooping problems.
Yes. And applesauce, right? Once you take the skin off the apples and process it up, that kind of binds up the
binds
poop
up too. And pears, same thing. If you take the skin off the pears, apples and pears can also be constipating, but bananas, super constipating. And babies love them typically. One of the foods that I like the best for especially infant poop though, or in making sure infants are staying regular, prunes.
Yes.
I love pureed prunes for babies who are a little
and babies
constipated.
like them too. I mean, they're sweet. They don't have any hang-ups about what they are at this point.
Nope, they work great and they move everything through. I love it.
Yes.
But let's say it's bad constipation.
Yes.
This isn't going to do it, right? We already have these huge stools. All of these like things that are going to make it a little bulkier are not going to help. We need to actually treat the constipation. And that is important. It needs to be treated.
Right.
So what's your favorite way?
So the only way to go really is Miralax, which comes from the term miracle laxative. Miralax. And so it's polyethylene glycol, which is a very safe product that's in a lot of our things in our world. It's very safe, very effective. You use it with a lot of water to make it work, and then you poop all of it out. So it doesn't stay in your body at all.
It's been there really for more than 20 years that we've used it very safely in kids. And even though it never got an FDA approval for under 17, it is, there's like reasons for that have nothing to do with the actual medicine.
Right. It's been very well tested. It's been in a lot of studies through pediatric hospitals and
pediatric gastroenterologists.
They've been studying it for a long time, but now that it's generic, because it came out for adults first, no one is going to go through the long, expensive process of getting FDA approval when we know it's safe to use because of all the other studies that were done.
Yeah. And I like to call this, I love Miralax. I think it works great. And there's a few reasons I really like it. One is that it's a very gentle laxative. So it's not going to like cause your child to go to the bathroom right away, right? It is you drink it the night before and might go poop the next morning type thing.
Right.
If you drink a lot of it with a lot of water or other fluids, it will help do that a little more faster. Yeah.
There you go.
But in general, it's still gentle.
And it doesn't taste like anything, doesn't smell like anything. It's little sprinkles you mix into water preferably, but another drink if they just won't drink that water at that time. And you have to mix it for a while. But you can also just tell them it's magic powder, or fairy dust or whatever. And they get sold on that. It's fine, right?
Yeah, I like it. I found that my kids, when I used it for them, warm liquids do great because there is a texture to it. And so Again, some kids can taste the texture and they don't like it, and there are specifically kids who really don't like textured things.
Mm-hmm.
And if you mix it long enough or mix it in warm fluids, it actually dissolves completely, and there's really not a problem. My kids loved it, and we did chamomile tea before bed.
We did a lot of Ribena. I'm going to do a little product endorsement for Ribena. It's a black currant concentrate that you put in water in there, and you just need a little splash of it to make it taste good, and
then stir it all up.
Stir it up there. Yes.
But yeah, the other one that my kids loved was hot chocolate. Like, I really fooled them with hot chocolate all the time.
And then later on, they're like, wait, hot chocolate doesn't make me poop? What's going on here? So it's very safe. You know, it typically will give some diarrhea at first, but that's because it's easier for soft poop to come out than the big hard poop. So when you first take it, the first couple stools will be softer.
Well, and we're aiming for that. Like, if you've had really long-term constipation for a while, we need to get everything flowing outward. And so we're sort of aiming for loose stool right at the beginning. And then you kind of pull back on how much you're using, titrate it down, but you will still need to use it for several days, weeks, even possibly months at smaller doses, to make sure that you're maintaining soft, like loose stool, or soft,
formed stool.
Formed stool.
That's the word you're looking for.
That's
formed
what I'm like.
Yes.
Soft formed stool that doesn't hurt and is not too big. Thank you.
Yes, you're welcome. I'm here for you. There was some negative publicity about Miralax a few years ago, but causing behavioral side effects. But really, it was a very small number, yet much quoted study that when I was trying to do the research for this, I couldn't even find the original article. It was just quoted so many times and had been disproven by so many other studies. And really, it was probably the group of kids that were being used for the study are kids with constipation who end up having some behavioral issues.
Right. I mean, if your kid's constipated all the time, and again, running away to hide, to go to the bathroom, and
being embarrassed,
also having abdominal pain.
Yeah, like all the time. When you're constipated, you have it all the time.
And so you are going to have some behaviors that are very common with this. And again, not associated with the Miralax or the treatment, but which is, again, safe, gentle laxative.
And laxatives are not addictive. I mean, they really work by just pulling water into the colon to push the stool out. It's the same thing people use for colonoscopy clean outs, right? We just don't use as much volume as you're used for a clean out as a daily dose. And it really is, your bowel is not getting used to it. Right. Your bowel is just reacting to the water.
And they will be able to poop without it. It just makes it easier until everything has shrunk back down to normal size. That's what I tell parents. And that takes as long as it took to get there.
Right, exactly.
So if it took 2 months or 6 months or a year to get there, you might be several months doing your Miralax until everything gets better again. The other thing I always talk about is that constipation comes back at, again, times when kids don't like to poop.
Right.
So transitions from, like, vacation is a huge one. Like, who wants to go poop in a bathroom on the side of the road?
Who wants to take the time when they're having fun playing at the pool, in Disney World?
Or they have to go poop in the airplane and they're like, I'm not going in that bathroom.
No, I wouldn't go either.
Yeah. So again, those are times that constipation becomes really normal. And again, if you have a little bit of Miralax, you can usually treat it easily, and with a lot of water and fluids.
And also the diet on vacations lends itself to that.
True.
Pop-Tarts, when you talk about Pop-Tarts, #1 constipation producer probably of any food. So if you don't want to poop somewhere, eat some Pop-Tarts.
What other
medicines that you can use are Senna or Biscoidal. Both of those are stimulants that kind of push the colon. They're safe to use daily, but they're not always well tolerated because they give a little bit more belly pain and make you go a little faster than Miralax would.
Docusate, also a stool softener, safe, not super effective, but it is safe.
Mineral oil was the thing that we used before Miralax came around, because we've been around long enough that they used to not be Miralax.
We're old.
And mineral oil really works well, but it tastes as bad as it sounds, right? You're just eating gross oil. And it used to cause it still does, leakage. So you'd have where they sat on the couch is a little pool of mineral oil.
Yeah,
Ew.
Not super easy to clean and really not very comfortable for anybody.
No.
And then magnesium, again, available in lots of different forms. Some that taste better than others, like your Pedialax or your magnesium chews.
Those mag chews are pretty tasty, but they don't work that great.
Yeah, and also it's when it's in milk of magnesia, which actually works great, and your milk your mag citrates in their milk of magnesia, but it is what I call a little bit
Aggressive.
Aggressive, yeah.
Yes.
It is not a gentle laxative.
No, it's going to make you run to the bathroom really fast and have a lot of belly pain.
And also have tummy pain with
Yes.
it. So it's not my first choice.
Yeah.
What about for babies? Like, because we
Yeah.
don't really use Miralax unless they're 1 and over and
really,
drinking fluids
right.
well.
And that you have to drink a lot of water for Miralax to work. So it's really toddlers that you just can't always guarantee they're going to drink a lot of water.
Yeah.
So before that age, you typically use lactulose, which is kind of the same idea as prunes. Like it's it's disaccharide. It's just a synthetic form. It's very safe for babies. Doesn't change their electrolytes or their water balance, but it does cause some gas and some belly bloating.
And it does go through pretty well, and in fact is not really absorbed again. So it is good for baby pooping.
It's actually a prebiotic. You know, like food for your bowel.
Yeah. And then enemas and suppositories, which we, especially as pediatricians, don't love to use. There are cases when you have to, like when there's really not another option to get that really stubborn, like hard last part through. But we try to use all the other things. We'd much rather work it out from above in a manner that's not like shoving something in and making them really uncomfortable.
A lot of kids with constipation already have some negative connotations about their bottom, and you don't want to have like further negative connotations.
Yeah. And then again, I just really encourage parents to remember that this is not their fault. They're not doing this on purpose. This is not a behavioral thing that they did to make you mad. This is hey, this hurts. I don't want to do it. And it's a normal response. And it leads to things that can make them really have a lot of discomfort and embarrassment about this. So be kind, be empathetic, and work with them through this.
Just like your statement. In life, be kind, be empathetic.
It's not always easy to do that with our kids,
It's not always
though.
to do that, yes. So I think we've kind of talked about constipation enough. Maybe we should talk about another problem now. So GERD, which is gastroesophageal reflux disease, the D is the disease, is very common. Everyone experiences reflux at some point where things just come up a little easier.
Yeah, if you listen to our newborn thing, all babies reflux. Again, that's because that little sphincter is not working so great. It's like it has the tone of the regular muscle. And most baby reflux is not a problem. We don't worry about it.
It's messy.
And there's a lot of actually adult reflux we don't worry about. Like if you have a little occasional burping up stuff, that is okay. Yes. When it starts to be a problem is when it's really causing pain and like keeping you from doing things that you want to do.
Right, and that's what we really worry about with GERD in the little kids, like less than 5 years old, is they start to associate pain with eating, and then like, why would I eat? It hurts me. And then they stop wanting to eat, have some oral aversion. And
that's where it really goes into the disorder or the disease, because they can actually have vomiting, bad abdominal pain, stop eating and lose weight, or just refuse to feed at all, which can be a really big problem for that young age.
Yeah, and when I ask, and probably do too, kids in clinic when they're having belly pain, if they vomit in their mouth and swallow it back down, a lot of times they'll be like, yes, and the parents will go, what? You never told me. But the kids didn't know that it was abnormal. Right?
They didn't know that that wasn't what they were supposed to be doing. It's stuff comes up, I just swallow it back.
Down, right? Yeah. And they'd be like, I've always been doing that my whole life. It's not normal.
But that is what we're trying to get to when we're talking to kids about it. And a lot of times you really do have to ask the child this. Parents won't have recognized that this is happening a lot. And so we ask the child and they're like, oh yeah, like, do you have that stuff that comes back in your mouth and you have to swallow it back down? And they're like, yeah. I'm like, oh, well, that's reflux.
Right.
So, and it's the same thing that we call like heartburn or stuff in adults. So first of all, if you really think that that's what it is, and you make sure that there's not other reasons causing it, but you can actually treat it with some over-the-counter things. Like if it's really uncommon and it happens every so often, you can do the small chews like you would do for bigger adults, and definitely smaller doses.
Like Tums,
yeah, like a Tums,
calcium carbonate, yes.
And that can work. And then the other thing you can also do is H2 blockers or those types of things, like your Pepcid. And that can work. And we tend not to go to your stronger things like your proton pump inhibitors unless there is really a problem with gastroesophageal reflux disease. And that we do on a different basis. And we're really trying to figure out why they have such bad disease at that point.
And I was just the behavioral part. I'm like raising the head of the bed and not the pillow, not raising the mattress, but literally like, a block of wood or a textbook like 2 inches tall underneath the head of the bed. So when you're sleeping, your head is slightly higher than your stomach. Takes care of about 85 to 90% of reflux symptoms
At
during the
night.
day.
Yeah.
Well, in the morning when they get up, if they
Yeah.
wake up feeling nauseous. And then diet, we know carbonated foods, carbonated drinks, and then spicy foods or really acidic foods, like a lot of tomato-based products. Those make you make more acid. So if you go to eat those before bed or drink those before bed, you're just more likely to have reflux at nighttime.
Right. So try not to do it. Actually, eating before bed, like right before bed in general, is a bad thing for anybody who refluxes.
Because your bowel stops moving while you're sleeping, so things just hang out there and then they come
back
back up.
Yeah.
And mint, that's what a lot of people don't realize, but chewing gum really increases your reflux.
Yeah.
And so you try to limit your mint exposure, which is sad.
I know.
Inflammatory bowel disease is Crohn's and ulcerative colitis.
And the inflammatory bowel disease is really the name of it because that's what happens. You get inflammation in different parts of your bowel. For ulcerative colitis, it's really in the colon, like often, and starting from the rectum and then kind of moving upwards, and it's all together, like contiguous. Crohn's is inflammation that can happen anywhere
from
like
the esophagus
the GI
to
tract.
the rectum, and will almost be patchy in places sometimes.
Yeah, and so it is a slightly different, but inflammation in both cases.
Right. And the peak incidence of onset of IBD, that's the acronym, is between the ages of 15 and 30 years old.
But there is some rise in numbers, and we don't know exactly why, in younger kids. We also don't know why some kids get inflammatory bowel disease and others don't. We know that
it's family history.
There is some family genetics associated with it.
Right.
And some environmental factors that we think. But in general, we're not sure exactly why.
Yes.
It is.
And they're still trying to figure it out. But we have good scientists, and we're working on it. There'll probably be a test at some point, the genetic buccal swab. You'd be like, oh, I have this risk for IBD. So
it is thought to be an autoimmune disease, though.
It is definitely on that spectrum for sure.
Yeah.
Crohn's disease is twice as prevalent as ulcerative colitis in kids, and boys are affected more than girls.
And then you have in the United States, 2 to 4 of every 100,000 kids develop ulcerative colitis, and about 20 to 30% of all those cases are in kids 20 years and younger. The incidence of inflammatory bowel disease among children, like we said, has increased, and we're not sure exactly why that is. But when it is significantly younger, it tends to be more severe.
Yes. So what do you think about what symptoms are you thinking would lead you to the idea of IBD?
Yeah, the presenting symptoms typically are, again, bloody stool.
Yes.
Like bloody stool's bad.
So have your kids talk to you about their poop.
Yeah. And this isn't like that constipation blood that we talked about where you have a little tear and there's might be a little bit of blood on the outside of a hard stool. This is often stools that are soft and have a lot of blood. So it is a significant amount of bleeding that's happening within their colon.
And a lot of times waking them up at night to go to the bathroom. Again, this is kind of an abdominal pain that wakes you up at night, and then they get up to poop in the middle of the night.
Right. And often have their tummy hurts. This is painful. Like you can imagine, like these stools, especially when you have blood in your gut, it is very irritating. And so you tend to have looser stools more frequently and often associated with pain. And so they don't want to eat. And so often they'll lose weight. They can have fatigue because they get anemic, like they lose blood. And in fact, that's been the case. And when I have seen this in young children, they come in very anemic because they are losing blood through their stool and pretty tired.
And they don't get taller. And that's the thing is Crohn's often before they even get bloody stools, you can see that their height has stopped. They stop getting taller. And so it's super important that you have your doctor, your provider, check a height and a weight at every visit.
Yeah.
It's very subtle sometimes, and the earlier you can pick up the disease, the sooner you can treat it.
Yeah. The other thing that I always say is that kids want to be kids. So when I've seen this present in childhood, it's sometimes really hard because they're going to do everything they can to still keep doing what they love. If they love playing sports, if they love doing this, even with all of these symptoms that would keep us in the house and
Mhm.
away from things and going to the doctor right away, they're like, I don't want to go to the doctor. I don't want to do this because I want to go play soccer, or I want to do this. They try so hard to keep everything still going the way they want. And so sometimes you really do have to tease out this situation. And it really so important that if your child has abdominal pain, look at their poop.
Yes.
Like, don't say, oh, like coming into the doctor, well, I don't know how they poop. Like, go find out before you come
and a
and
lot
see
of times,
us.
I say to parents, I'm like, just tell them not to flush. They don't have to be in there. You don't have to
Right.
witness it, but like, just say, let me just peek at it before you flush it down, right?
Yeah.
But it is helpful to you and to the doctor to be like, okay, this is what it looked like.
Yeah. How do we diagnose these?
So there's blood tests and stool tests that we do that kind of give us an idea, but the gold standard is colonoscopy with a biopsy. So eventually you'll get referred to GI doctor if we suspect inflammatory bowel disease.
And they'll just make sure, like, and because they actually really are looking at those areas that have inflammation and where that information goes to determine whether it's Crohn's or ulcerative colitis or something else.
Yes.
And then how do we treat it?
Well, the good news is, again, we're old enough. We've seen the changes in medical care that, I mean, when we were in residency, med school and residency, this was kind of a diagnosis that once you had it, you were going to be in the hospital all the time. Surgeries, medicines that had terrible side effects, really giving up those things that kids love to do because this was all consuming. But now we have much better medication. We have some topical medication that kind of starts for ulcerative colitis.
And that topical meaning topical in the gut.
In the gut, right?
Like,
yes, that
right.
they either swallow it or
right
in the rectum. Most kids with Crohn's are at least initially started on an anti-tumor necrosis factor medication, which is Remicade and Humira, and these are IV medicines that are given either 2 weeks or 4 weeks or 6 weeks, depending on the severity of the disease, that they're really well tolerated.
Yeah, you know? And they're immunosuppressants, meaning they suppress our immune system from working against itself because, again, this inflammation is autoimmune. And so they basically, it's our body kind of working against our own cells in our gut. And so these are the immunosuppressives. For ulcerative colitis, they actually try other ones first, like your topical aminosalicylates, and steroids are your big ones that they start initially. And then often, again, as the disease progresses, they go to some of the same ones we use for Crohn's, which is your immunomodulator treatments and your biologics now. Yeah. And they are really, really effective. And this has changed the whole. It has. It changed the whole realm of inflammatory bowel disease.
You know, and I was talking about, I had a patient that got diagnosed with Crohn's 2 weeks before they were starting college. And, you know, 10, 15 years prior to that, we would have been like, sorry, you can't go to college this year. But they got her started on medication and she started her freshman year and she did great. Yeah. Right. So it really is one of those, you know, miracles of medical science that we can see a difference. Like, yeah. Kids are healthier.
And they often can even go into remission. And remission's like a great thing, like exactly what it sounds like, right?
Great word.
So they can have a very normal life with ulcerative colitis and even Crohn's. And so meaning that they can do everything they want to do. They can play sports, they can go to college, they can have a wonderful life. They do need to keep getting checked out.
Right. They have to keep seeing their GI doctor, being followed to their labs, and also being screened for colorectal cancer, which is increased risk, especially for ulcerative colitis.
Yeah, and especially like starting at 10 years. So if you have a child that was diagnosed fairly young, that 10 years can be in adolescence. Right. So they really need to get checked regularly with their GI doctor. But this is, again, such an amazing feat of medicine that it's much better than it used to be.
Functional abdominal pain is the last major category of abdominal pain we're going to talk about. It's now been renamed to disorders of gut-brain interaction,
which really is a horrible name. I don't even know.
I mean, it says like what it is, but it's not so fun to say. DGBI. I don't know, right? We can divide that into 4 categories. So irritable bowel syndrome is the one that mostly, you know, adults are diagnosed with, but sometimes we do give that term for teenagers too.
Functional dyspepsia,
which is kind of, you know, reflux, but reflux that comes from stress in the belly.
And then abdominal migraines.
Yeah.
Which is exactly what you said. It sounds like a headache in the gut, which is super not fun.
Bad pain and takes you down for a while. And then the last one, functional abdominal pain, NOS, which is like the medical thing of like everything shoved else into one category, right?
We can't figure it out
no
because
other specified.
we've like ruled out all the other things, and so now we're left with the kind of functional abdominal pain not otherwise specified.
And this diagnosis is made after you kind of rule out the other things that could cause abdominal pain. You don't want to miss inflammatory bowel disease. So when a kid has abdominal pain, we're like, let's look, make sure we don't have that. But if we're like, oh, no, all the testing is negative, you probably have a disorder of gut-brain interaction.
Right. And treatment really is differing depending on what it is, like we've discussed before, but also on the symptoms specifically. And so a lot of times you're looking at things that really are more difficult for you. So that might be some triggers in your diet.
Yes.
And so often they talk about the low
FODMAP diet. And the FODMAP diet is their acronyms for different kinds of food. And we kind of know that food can be low fermenting or high fermenting in terms of digestion. And you know the sound your belly makes when it goes, that's called borborygmi, which is like the best medical term ever because it just sounds exactly like what it is.
I don't even know if I can pronounce that.
You can say it, borborygmi. And so those are foods that require high fermenting. And so people who have more sensitive bellies, if they're eating foods that require more fermenting, they're just going to have more belly pain, more gas, and feel worse. So this FODMAP diet, you kind of look at the ones that are low fermentation, which would be more like fruits and vegetables and easy to digest foods,
right? Versus
the high FODMAP would be more like dairy products, gluten, beans, corn, things that just take a little more work for your belly to work on it.
The one thing I really focus on in this too, though, it's not an allergy.
No.
Right? A lot of people come away saying, "Oh, I'm allergic to these." You're not allergic. That is not what's happening. It is causing you discomfort though.
Right.
And so trying to eliminate them or at least decrease them in their diet can help you through.
Like, and this is like everything else in life. You like find some weeks, find the other fight. So if you're having a bad belly day, you're like, I'm going to stay away from those food today.
Yeah, exactly.
And then I'll make less belly pain.
And then there are some medicines that you can use to decrease abdominal spasms, or not even meds, but like things that you can eat, like peppermint tea, like can settle your tummy. Not great for reflux,
but it can help your like gassy feeling.
It can help your gassy feeling.
Yes, simethicone, right, which is what we give to babies for gas. That's always safe to do, and really kind of helps the bobbles go away a little bit.
And then the probiotics,
right?
Yeah, probiotics can help. And then really, what probably helps the most, if there really is truly an anxiety or worry component to your abdominal pain, is cognitive behavioral therapy.
Right, and that's rational thinking to combat those sabotaging thoughts that show up. When you're all stressed out and you're like, oh my God, I'm just so terrible at this. At that moment, you can't deal with it. But with CBT, you can go back and reflect on that moment and be like, what could I have done then? What thoughts could I have put in my head so I can move forward next time I'm in that situation?
And it really does help with these when it's
kind of age 9 is where we start saying, you can start working on some CBT. And there's even like little workbooks you can do at home to practice with your kids, working on those situations that they get stressed out and they're going to have more belly pain with.
Yeah. And what works for everyone.
And everything in life.
And everything in life. Hydration.
Water.
Drink a lot of water. Being well hydrated. Making sure you're eating regularly. Small meals more frequently is better than waiting and like eating a huge meal before bed, right? Like that is not going to sit well with you. Decreasing stress and anxiety as much as you can.
Yes.
Even though sometimes it's a pretty stressful world right now. And then exercise. All those things are going to make your life better.
Yes.
So in general. Yes.
Well, I'm Dr. Joanne Smith.
And I'm Dr. Corinda Hankins.
And this is A Podful of Pediatrics. Thank you for listening.
And we hope that this information helps you keep your child happy, healthy, and
safe.